Welcome to Beyond the Prescription podcast. Today we are super excited to talk about insurance. We know it's not one of those most exhilarating topics to talk about with your health, but it is essential. So today we're going to be interviewing Lauren McClain with Runyon Insurance. She's an insurance agent, and we are going to talk about all things Medicare. We're going to talk about open enrollment. So you might want to listen because there's going to be some tips that you need to know. Lauren, welcome.
Thank you. Thanks for having me.
Yes, I'm so glad you're here. You have a slew of information to tell us about insurance. So we are just right around the corner on open enrollment, on what we call it. So I definitely want to talk about that. But first of all, I would love to have our viewers know about Medicare. So what is Medicare? All the different A, B, C, D, E, F, Gs, and all of like the insides of that and what they cover. Because honestly, I think it happens for a lot of people. They all of a sudden are 63, 64. They're supposed to, start to apply for all this, and they really don't know. So I think it would be so beneficial if you could just kind of start from the beginning.
Sure. So interesting you said that. I had a lady in my office this morning who is turning 65 in February, and she just feels confused because she didn't know where to start. And it's overwhelming. You have gone from probably 30 years of working in an industry where you had group health insurance and you understood it and knew how it worked. And now all of a sudden you're being told that that's not what you can have anymore. So Medicare, I believe, is a beautiful thing as long as you have, there's ways to qualify for Medicare. Generally, working and having your Social Security credits will qualify you for Medicare. Sometimes if you work like teachers, for instance, they don't always qualify for Medicare. So there's some different industries that people don't get Medicare. But for the most part, I would say generally our population enrolls in Medicare. So there's Medicare A and B, which is administered through the Social Security Administration. So when you need to apply for Medicare, you go through Social Security to do that. There are premiums associated with A and B. Some of that is based on your earnings as a retired person, so it's not always cut and dry like what you specifically are going to pay for your A and B. But once you get enrolled in A and B, it usually starts the first day of the month that you turn 65 or whenever you lose some people work past 65, right? And they might stay on their group health insurance. So it's really whatever month you're going to lose that group health insurance. And it usually starts the first day of the month that happens. So you will get A, which covers hospital visits, those kinds of things. And then B covers your doctor's visits. So you need a supplement in addition to your A and B to kind of pick up whatever A and B doesn't cover. So generally at this point in time, we would recommend you take a Plan G for your supplement. And basically the only expense you're going to have is to pay your Part B premium, your premium for your supplement. And then if you take a Plan G, you will have a deductible. I think it's going to be in 2026, every year it goes up a little bit. It was like $257. I think it's going up to $280 in 2026. So that's your deductible.
A month, or that's for the year.
That's an annual deductible.
Wow.
So a lot better than what we're used to with group health insurance, right?
Real quick though, I want to back up just a minute. So on Medicare, is it still they pay 80%? Right. You are responsible for 20%.
Yeah. So you don't have to have a supplement. You could go
just
without and then pay that yourself.
So I'm 65. I go to the emergency room and the bill is $1,000. I only have Medicare A. They're going to pay $800. I'm going to be responsible for the rest, the other $200.
Yeah, and as you probably are aware with medical billing, some of that's going to be hospital charges, some of that's going to be physician charges, some of it's going to be lab, that kind of thing. So those are all billed a little different. So it's not quite that cut and dry that it's 80-20, but yeah, that's you kind of get it.
The umbrella effect. So the 20% is where a Plan G is going to pick up for that.
Okay. Right.
Perfect.
And you're just going to pay that deductible, that $280 deductible once a year, or, annually. It might come out, you might get 2 or 3 doctor bills for that $280, however it works out. So, but that's all you'll pay. There are some foreign travel expenses that could happen on a Plan G. If you were eligible for Medicare prior to 2020, you could get a Plan F, and it covered a little bit more of the foreign travel, but usually that's not a huge thing for people.
So there's no longer like a Plan F for the foreign?
You cannot get a Plan F if you qualified for Medicare after 2020.
Okay.
Yeah.
So Medicare A covers hospitalization and like surgeries in like a hospital. Okay. Medicare B pays for if you're going to do outpatient, like you're going to go to the doctor. And then is there Medicare C?
So C is also known as Advantage. And so Advantage plans, when you decide to enroll into an Advantage plan, you're giving up traditional Medicare, and all you have is an Advantage plan.
So you don't have an A or a B?
Right. You've given that up and just have the C. Yes.
Okay.
So Medicare Advantage is it's a beast. It's a lot to understand. There are a lot of coverage issues, especially for people in rural areas. It's not generally something that we recommend our customers take. Just because there's so many moving parts with it, it's really hard to understand. We have seen people get hurt by an Advantage plan, and we don't want our customers to do that. Now, you can go to whoever you want to get your Medicare, plans. I'm not, I guess what I say isn't the gospel when it comes to that. But I just want people to make sure before they say yes to a plan like that they really understand what they're saying yes to, what they're giving up, how the coverage works, how it might affect them financially down the road. Those plans often look really good because usually there's no premium. They might include some extra benefits that you wouldn't get through traditional Medicare. So a lot of times they can make it look really good, but really you need to kind of dive in and see how those coverages are going to specifically work for you.
That is something that I want to kind of just stay here just for a minute, because I know as like an insurance agent, like you probably cannot say specific names and stuff for the Advantage plans, but I will, because I've seen too many people suffer. So I do have to agree with you 100%. Advantage plans, which would be the Medicare C, one specifically WellCare, and then there are other ones that you get a phone call usually, and they sell it to you over the phone. And anyone that is over 65, right, would qualify. And then they want to, like you said, they're going to give you you don't have a deductible, it's $0 or whatever. But then in this area, there's going to be hardly anybody that they have a contract with that they're going to cover. So you're having to pay out of pocket. That's no longer the 80-20. Right. You're paying the 100%.
Yeah.
So I would have to say, from being in primary care since 2015, I have seen people be financially burdened from taking on an Advantage plan, where if they would have just stayed with Medicare and possibly got a supplement, they would have been in a much better place. They would have some out of pocket, but overall they wouldn't have the full amount.
Yeah, it's a lot easier to plan for your budget when you know what you're going to expect.
And WellCare and other Advantage plans might be good maybe in like an urban area.
Absolutely.
Not in a rural.
Yeah, so, that's really my belief.
Yeah, I believe that too, because they would, whenever you look up who they are covering and where they're covering, big cities, absolutely. Rural counties, please stay away from them.
I just really feel like, especially in an emergency, like I've said before, we don't know when we have an emergency here in Olney, Illinois, where we're going to get sent, right? We could go to Evansville or Indy or Springfield or Champaign or St. Louis. We just don't know. And it's going to depend on what our needs are. And I certainly want them to send me where I'm going to get the best care for my needs, but I don't want my health insurance to dictate that.
Right.
Or to leave me with a huge financial crisis at the end of it. So,
okay, very good. So, just to summarize, Medicare A, hospital, Medicare B, outpatient, Medicare C, or also known as Advantage, is you are opting out of Medicare A and B, and then you would be in a plan that we don't recommend in a rural area. So let's move on. Medicare D. What is that?
So D is for drug. That's the easy one to remember because it actually goes together.
Yeah.
So Medicare Part D is your drug plan, and you can only change your drug plan during open enrollment, which the drug plan open enrollment started yesterday, October 15th through December 7th.
Okay.
You can change your drug plan every year, no underwriting, no issues with anything like that. So as long as you switch during your open enrollment, or if you're new to Medicare, you can sign on at any time, obviously, if you're new to Medicare. But if you're already in a drug plan and you're like, I'm not sure if this drug plan's really working for me, then you need to go see your agent or go to Medicare.gov, and it's really cool. We literally just type in all of your prescriptions with your dosages and what pharmacy you use, and our system tells us what plan is best for you.
Wow.
Now, if a plan is best for you and I don't sell it, I'm going to tell you that. A lot of these drug plans have gone away from paying us commission anyway, so it doesn't really affect me if I send you out the door to get a different plan, because I'm not going to make anything if I sell you a plan anyway. So I really do want what's best for you. So if the best plan for Marlissa is, I don't know, a plan I can't sell you, I'm just going to tell you, hey, it looks like this is the best plan. You can go on Medicare.gov yourself. You can reach out to this plan yourself and get signed up for it. So it's pretty cut and dry, because it really, there's no brain work for me. As long as I've plugged everything in right, I'm going to be able to tell you what plan is best for you.
So as if you feel confident, on the computer, if you're 65 and older and you feel confident, you can go to Medicare.
Yep.
And do it yourself. Yep. Put in your meds.
Yep.
Okay.
Yeah.
So you don't have to be an agent.
Nope.
Okay.
Nope. My grandma does it herself every year. So,
awesome.
Yeah. She doesn't anymore. I guess I should say that. Now that I can sell drug plans, she does it. Okay, so new for 26 with drug plans, the max out of pocket is $2,100. It was $2,025. So that was changed effective January 1, 2025. The max out of pocket used to be a lot more.
Okay.
But there were some legislation changes that brought that number down, which is really good for people. And then the Part D deductible for 26 is going to be $615. So what most plans, if you are taking a tier 1 or a tier 2 drug, a lot of plans you don't even have a copay for those.
Right.
So there are multiple plans out there right now that there's zero premium. And as long as you're on a tier 1 or a tier 2 drug, you don't pay anything for them. So those are really beautiful for people who aren't taking a lot of medications and definitely not taking a name brand. Where we generally see people get hurt in a drug plan situation is when we are needing to take Eliquis, or some certain inhalers seem to be really expensive. Eye drops, for some reason, there's some of those that seem to be really expensive. Those seem to be some common drugs for people who are aging. And so that's why it's really important every year to just kind of plug those drugs in, see what plan's going to be best for you. What pharmacy you use dictates kind of what plan's going to be best too. So there's a lot of things for people to think about when it comes to drugs. I always tell my customers, call me every year. It just takes me a couple of minutes to update that. And I would much rather you spend a couple minutes making sure we have you in the right plan. So,
okay, so you would pay for a deductible with an Advantage plan or Medicare G. Is that what you're saying?
So a drug plan has its own deductible.
So you would have two.
Yep.
So you'd have a Medicare D or a drug plan deductible. Then you'd have a supplement deductible.
Right.
And then so one deductible is going to be what you said for the supplements, going to be around $200 and some a year.
Did I say 280? I keep forgetting that number. Yeah, 280.
And then a drug plan is the deductible is going to be, what'd you say?
$615.
And that's
for
per
26.
year.
Mm-hmm.
Okay.
Yeah. A lot of people don't hit their deductible for their drug plan because I see probably more people that just take like a couple tier 1 and tier 2 drugs. And so they are not really ever going to meet their deductible. They're not paying much. Sometimes a tier 2 drug, you might pay $5 copay for it, but a lot of times you don't even reach that deductible.
Okay, so what about, we got rid of the donut hole, correct?
Mm-hmm. So we just have that true max out of pocket now.
Okay, and that is huge for people because obviously it was like probably around this year every time this year they would have been in the donut hole of where they had met their expenses, but they would no longer cover, right? Or something like that.
It was so weird. There's this catastrophic, and there's still some catastrophic coverage. It's really hard to understand.
But that's all gone now, the donut hole.
Yeah. Yep.
Beautiful. That's great to hear. So you would recommend, just from your experience and things, getting a Medicare
supplement policy
and a drug
plan. Yeah.
Especially if you're on multiple medications.
Yeah.
What if you're not on any medications?
So I still recommend you sign up for a drug plan. When you first become Medicare eligible, I think it makes sense to get a drug plan because if you don't take it when you're first eligible, and then let's say 5-6 years down the road, you get prescribed something, you need it, you then have to pay a penalty when you first get your drug plan. So if you have gone 6 years without a drug plan and then all of a sudden you're like, oh, I want a drug plan, you're going to pay a penalty for every month that you should have had a drug plan and you didn't.
What?
I know. It's so weird. So there are so many $0 plans out there right now. You would be silly not to just go ahead and sign up for a plan just so you don't have to pay that penalty later.
Okay. Well, that is good to know. I did not know that whatsoever. Yep. So what are you looking at? And I know you can't tell me exactly, but if you're going to get a drug plan, what is your monthly cost going to be on that?
So for a lot of people, if they're just on a 1 or 2 tier drug, nothing. There are multiple companies now with a $0 premium plan.
Okay.
And then, like I said, they are not paying anything out of pocket depending on what their drugs are. So you may be looking at $0.
Okay.
Which would be silly not to sign up, right?
Yeah. And so let's say you're on one of those eye drops or you're on Eliquis or something like that and you hit your out of pocket, your $600 and some dollars. Is insurance or is that plan going to pick up?
I'll just tell you, I ran one yesterday for a lady who is on Eliquis, and she had been paying a lot every month in 25 for her Eliquis. Hers looked a lot better in 26. So the first 2 months, I think she was paying around $250 copay for her Eliquis, and then, or probably some of that was deductible. And then from March through December, she was only going to pay $50 a month. So, not terrible.
Yeah.
I mean, I've seen people where they have to pay like $600-800 for their Eliquis a month. So.
Yeah. And unfortunately, just because, I'm side by side with the patients, and if you're on Social Security and you're on a limited income, unfortunately, if you need to be on Eliquis, which a lot of people do, if you've had a heart attack, stroke, AFib, any of that, or a PE, you have to decide, do I pay for my medicine? Do I pay for groceries?
Right.
Unfortunately.
So hard. And
I do see a lot of people, they're going through Canada pharmacies and they're going through other pharmacies that maybe aren't, that we don't know a whole lot about.
Yeah, they're not regulated.
Yeah, and so, but these people are like, well, I either have food on my table or I take my medicine like I'm supposed to. Because if not, they can't afford it, and it's just a difficult situation for a lot of people who are on that limited income.
Right. And one of the changes that came about last year with the drug plans was that if you do have one of those drugs that costs a lot, especially at the beginning of the year, you can spread that out over the whole 12 months. So you can actually call your drug plan, like whoever administers the drug plan, and you can tell them, this is how much I'm going to pay out of pocket, and I want to spread that out among the 12 months. And they'll go ahead and pay the pharmacy, and then they're going to bill you for that. It's a little bit complicated, but if they're truly struggling to get those first few months met, that's probably a good way to kind of offset some of that expense.
And then also there are some programs, aren't there, like the actual pharmaceutical company?
Yeah. So a lot of those saver cards don't work if you get
on Medicare.
Yeah. So that's a little bit harder. but you can still go to the drugs website and they have applications, and sometimes they will give credit, if you have Medicare. I always tell people too, there's like, if your income is lower, there are other ways to get help. There's extra help through Medicare. It's kind of Medicare and Medicaid teaming up together to give some drug plan extra help. So it's certainly worth looking into all of those things. I mean, nobody should struggle to eat or take their medication.
Right. You mentioned Medicaid, so I just want to touch on that for a minute because our focus today is Medicare, but some people, they're confused on Medicare, Medicaid. So can you explain that?
So Medicaid is needs-based, so you have to qualify for Medicaid because of either a disability or an income limit.
And no matter what your age is,
Correct.
You can be on Medicaid.
Yes.
Medicare,
you have to qualify. So Medicare, you're either 65 or you've been on Social Security disability for 2 years. Then you can also qualify for Medicare that way.
Okay. So, all right. So I hope that helps clear up because those terms, they're similar.
And they sound so much alike. People get them all confused.
Yeah. Yeah, very good. Because, I'll have patients come in and they'll be like, well, I don't have Medicare. I just have Medicaid, but they're 72. And I'm like, well, you probably have Medicare as well. And then I also have patients that aren't even for sure if they have Medicare, and they're over the age of 65.
Yeah.
So
the red, white, and blue card is Medicare. And that's how it's usually easiest to know. Do I have Medicare? If you have the red, white, and blue card, you have Medicare.
Yeah.
And then on the card, it'll say if you have A and B, because some people might have A and not B. If they did continue to work after they turned 65, they would go ahead and get A, but they would stay on their group health insurance and wouldn't have B. So that gets confusing too.
So your if you're 65 and you're still working, you can get Medicare A and then have your private insurance cover for your outpatient.
Yeah.
Okay.
Yeah.
Very good. So.
I will say also for a supplement, you can change your supplement anytime. You don't have to do that during open enrollment, but if you change your supplement, you have to go through underwriting. So usually when you first sign up for Medicare and you first sign up for your Medicare supplement, there's no underwriting questions.
Okay.
But then if you choose to change your supplement at any time, you would go through underwriting.
Okay.
So that gets people tripped up sometimes. And I will just throw this out there. All Medicare rates have gone up significantly in the last year.
Okay.
So we've had a lot of phone calls is there anything better? Pretty much they've all taken about the same rate increase. So they're all about the same. If your company A was this and you're thinking maybe company B will be better, well, they took the same rate increase, so they're still 10% higher or whatever. Does that make sense?
Yeah. So whenever you have Medicare, you're talking about with the supplements.
Yeah.
Okay.
Mm-hmm.
So, because the Medicare part doesn't necessarily cost you an out-of-pocket every month. It is just the supplement that you're talking about with the rate increase.
B, you do pay out-of-pocket for Medicare B, but it comes out of your Social Security check, so most people don't even realize that they're paying it.
Okay. I did not know that.
Yeah.
Very good. So A is covered, B comes out of your Social Security check, and then the rate increase is on your G plan or your supplement.
Yeah.
Okay.
And they have been significant. So, but I wanted to throw that out there because I want people to understand it's not just them. All the companies have been taking rate increases. So.
Yeah. Just like everything else, right?
Unfortunately, yes. So can I also talk about just open enrollment for healthcare?
Yes, please do.
So I kind of threw this in on Melissa at the last minute, but I feel like it's important that we talk about this. In Illinois, for 26, they've moved to their own marketplace for health insurance. So we have a lot of customers who went to healthcare.gov, filled out their application, got their health insurance through the federal marketplace where they would get a subsidy to help offset those premiums. For 26, Illinois has gone to their own marketplace. So in order to continue your health insurance, you have to go to getcovered.illinois.gov and complete a new application. Now, they've told us that if you already had a federal marketplace plan, that information's supposed to slide over nice and neat and everything's going to be filled in. But we can't get in there until open enrollment, which that open enrollment is November 1st through December 15th.
Okay.
So if you already have a federal marketplace plan, please make sure you reach out to your agent. so that they can help you through that process. It's very important that you do that or you're not going to have any coverage come January 1st.
Okay.
I'm sure you guys have probably heard Health Alliance pulled out of the market.
They're like closing.
Yeah, December 31st. So that takes one plan out of the market for us. So I don't know, but I assume the only one that you're going to be able to purchase in this area is probably Blue Cross Blue Shield, which a lot of people have Blue Cross Blue Shield around here anyway. So
is like Cigna and United Health, are they on the marketplace or no?
In some areas, so marketplace is determined by your zip code.
Oh.
So some zip codes can purchase other plans and some can't. So what I had seen for all my customers last year in this area was just Health Alliance and Blue Cross Blue Shield.
Okay.
So I'm assuming it's just going to be Blue Cross Blue Shield. But again, I can't see that until open enrollment starts, which is November 1st. So
okay, so whenever you're talking about marketplace, you're talking about the people that need to purchase their own plan because their employer is not, they're either self-employed or their employer doesn't offer insurance.
Right. Yep.
Okay.
Yep.
Very good. So, and then so even if they have always gone, so every year, like let's say if you have the federal marketplace, every year they have to go in and reapply.
You're supposed to.
Okay. And so now you're no longer going to go to the federal site. You're going to go to the Illinois site for 2026.
Right. Yep.
Supposedly everything is going to move over.
Yes.
But we're going to see. You're going to see,
Yeah,
right?
Yeah.
Okay.
And I was telling Morgan earlier that selfishly, put this plug out there, if you have an agent and you go to the website yourself and do it, which you certainly can, their NPN information, so like our producer number, isn't going to automatically pre-populate. So we would not be the agent on that plan anymore if you do it yourself. So I think it's a good idea if you've been working with an agent to go ahead and go back to that agent and have them help you through that process.
Application.
Yeah.
Okay.
Just because I know a lot of times customers will call me and they've had an issue with a claim or something going on with their subsidy. There's just something that they need help with. And sometimes it's nice to have an agent to help you through that process.
Sure. So one thing is, though, how are people like getting notified of this? Like, are they getting a letter in the mail? Are they getting an email? Is it like...
So it'll probably depend on what their preference is for notifications. So that's one of the questions on the marketplace application is how you prefer to be communicated with. So probably a letter. I know a lot of times I would put hard copy letter in the mail for my customers just because I felt like that was less likely to get missed. However, now you don't always get your mail or it takes forever. So
or you throw it away.
Yeah. I do that too. Or just don't read it.
Right.
So I do think it's important that people know that that's like kind of out there.
Yeah, that's huge. It really is because I had no idea.
And if you want your coverage to be in effect on January 1, you have to have it completed by December 15th. So it's really important that you do it.
Yeah. Absolutely. So I'm going to just kind of summarize again here in a minute, but is there anything else that you want to leave for our listeners and viewers that's essential related to healthcare?
I just think I really just want to thank you because I think as a provider, a lot of times you can just get like into the actions of taking care of your patients, right? And maybe kind of forgetting about this piece of it. And it really is an important piece of their healthcare. And so thank you for thinking of your clients and your listeners.
Yeah, I'm so glad. I'm so glad that you were willing to sit down and chat, and because you have like a vast knowledge of all these things, because it's what you do on the daily.
Yeah.
Where whenever, people, they're just living their life and all of a sudden it's 65 and all of a sudden they need to do something.
Yeah.
So
yep. We're happy to help anytime or put you in touch with the right people. So
that's awesome. So just to summarize, Medicare A is going to be your hospitalization coverage. Medicare B is going to be your outpatient coverage. Medicare C, or also known as Advantage plans, is something that opts you out of Medicare A and B, and often you will be responsible for a lot more if you are not if that person is who you're seeing or hospital is not covered by that Advantage plan. So just be aware of that. Medicare D is your drug coverage, and that is a different plan that you would pay out of pocket for. And then Medicare G is your supplement, which picks up the 20% that the Medicare A and B does not cover, which is 80%. So Medicare A is paid for. Medicare B comes out of your Social Security check. All of that being said, if you are 64, when can you apply?
I don't actually know that rule, but I always just tell people call Social Security, go online. All the rules are out there, but I think like you can do it pretty early.
Like you can do it like can't you do it like right when you turn 64 or 64 in 3 months or something like that?
Like the lady that was in my office today, she turned 65 in February and she did it last month. So
okay.
Yeah.
Perfect. And then Medicaid is coverage by the state of Illinois from anybody at any age, depending on your income and your need. So not everybody qualifies for Medicaid. Medicare is just at 65 or, like you said, on Social Security disability for 2 years. Mm-hmm. Open enrollment for people who are self-employed or that do not have insurance through your employer is changing for the state of Illinois. So be aware of that, where you're going to apply for the Illinois marketplace. We want to help everyone here in this community have the coverage they need so you aren't having to suffer from any financial burdens. I'm passionate about that. Lauren is also passionate about that. So is all the other probably insurance companies in this area. So we really, truly do care about you, your finances, and your health. So thanks for joining in to Beyond the Prescription podcast. We are here to talk about all things that are related to your health, and we're here to help you thrive.